Is this the single most important step that we have taken on health care since Medicare? Absolutely.
After months of rancor in the streets and histrionics in the halls of Congress,
do you have the courage to make these hard decisions when others are chatting away, saying
this should not be passed by anyone unless they eat it?
The vote takes place in just a few hours.
Is this a vast improvement over the status quo? Absolutely.
If there's so much controversy, it's because there's so much at stake. Coverage for 31 million uninsured Americans. Lower health care costs for many. More taxes for many others. Bigger government, to be sure, but also a boon to private insurers and small businesses. And most dramatically,
don't do it for me. Don't do it for the Democratic Party. Do it for the American people.
Barack Obama's presidency is on the line with this vote.
David Gergen is a professor at Harvard's Kennedy School and CNN's senior political analyst.
If he fails, it will be almost catastrophic for his presidency. If he wins, he will definitely get a place in the history books.
Over the past week, holdout Democrats were whipped into line.
If my vote is to be counted, let it count now for passage of the bill.
And on Thursday, the Congressional Budget Office gave a badly needed boost to the bill, estimating its cost as on target at $940 billion, even predicting a deficit reduction of more than $1.3 trillion over the next 20 years. But opponents aren't going down without a fight.
And if it feels like this long, angry, divisive debate over American health care has gone on practically forever, the fact is, it has.
The founding fathers didn't want to make it easy, and they succeeded beyond their wildest dreams.
Brown University professor James Marone has chronicled the attempts of presidents past to make national health care a reality.
The principles for which we stand are the principles of fair play.
Theodore Roosevelt made the opening salvo. He campaigned on health care for all in his 1912 attempt to return to office.
Today, a hope of many years standing is in large part fulfilled.
The idea was revived 2 decades later by yet another Roosevelt, Franklin. But even after getting Social Security approved by his own divided Congress, FDR found that universal health care was simply a bill too far.
Why don't we have it? One word, Congress. We've organized Congress in a way to make it very, very difficult.
Roosevelt's successor, Harry Truman, learned that lesson the hard way.
Truman believed in his bones, in his guts, that national health insurance was the most important thing for America. He took it to Congress. They had hearings. So many groups lined up to scream against socialized medicine that they didn't even take a vote.
Not until the 1960s would a savvy veteran of Congress finally make some headway. President Lyndon Johnson, formerly known as the Master of the Senate, had the political muscle to break the logjam.
He was always arm-twisting. There's the Johnson treatment of how he would grab a congressman and he'd pluck their jacket and he'd put his arm around them. And he's a big man, 250 pounds. And when you got the Johnson treatment, you just wanted to get out there and take a breath of air.
With his Medicare and Medicaid legislation, LBJ brought a form of universal health care to the elderly and the poor. His successor, Republican Richard Nixon, wanted to extend coverage to everyone else.
Throughout his career, he had a soft spot for health care. He was a liberal on health care. He came up with the great national health insurance proposal. We're not going to go with a single-payer, socialized medicine. We're going to leave the things that are in place in place. We're going to leave employers in place, we're going to leave Medicare and Medicaid, and we'll just try to cover everybody else using competitive mechanisms. It was the most creative new national health insurance bill, maybe in the entire story. And at the last minute, in spring of 1973, as Nixon is going down, the Republicans in Congress balked. And before anything else happened, Nixon had been resigned his office.
And healthcare reform was dead once again.
And healthcare reform was dead once again, but the Nixon plan is one Democrats would embrace.
Indeed, with the 1992 election of Bill Clinton, reform was back at the top of the agenda.
This healthcare system of ours is badly broken, and it is time to fix it.
First Lady Hillary Clinton presided over the closed-door drafting of legislation. Analyst David Gergen.
It was written at the White House and then presented to Congress almost as a fait accompli, and the Congress said, not invented here, threw it away, started over again.
That, plus opposition from special interest groups, proved fatal to the plan.
Having choices we don't like is no choice at all.
Yeah, they choose.
In the years that followed, healthcare grew from a concern to what many describe today as a full-blown crisis.
More than 50% of all the foreclosures in this country, more than 50% of all the bankruptcies are because people can't pay their medical bills. A lot of people don't realize right now every one of us is paying $1,000 a year because uninsured people are going to the emergency room because they don't have health insurance to go to a doctor.
And those are just a few of the reasons why reform advocate Ralph Nees of the nonpartisan National Coalition on Healthcare says after 100 years of trying, the time for change is now.
What good is it to have a job or to go to school or to do anything unless you have your health? It's almost a prerequisite to happiness and success in life.
So just what could the healthcare bill mean to you? Those currently getting insurance from an employer will
keep the same plan, same doctors, same everything. If they want to change jobs, they can't be denied in their future jobs or on their job now because they have pre-existing conditions.
If you're buying insurance as a small business or are self-employed,
your costs are going to go way down. The estimates are that they'll be 10 to 15 to 20% lower than they are now.
And perhaps most important, if you've got no insurance.
We're going to have 31 million Americans who currently do not have health insurance will get it. If they can't afford it, there will be Medicaid expansion or tax credits.
Of course, that last point has a very controversial flip side. The new bill requires almost everyone to go out and get insurance or pay a penalty, either several $100s or a percentage of annual income. Advocates say that's the only way to spread out risk and bring down costs. But opponents say it's throwing good money after bad.
Well, I think what you're doing in this plan is you're spending a lot of money to subsidize an inefficient system.
Dr. Scott Gottlieb is a fellow with the American Enterprise Institute. He opposes the health care bill because of that mandate and the fact that some upper-middle-class Americans may see overall health insurance costs go up.
You'll see insurers pull out of certain markets. You'll see insurers try to aggressively hike premiums in certain markets ahead of implementation of the bill.
Can you hear us now? Can you hear us now?
And what about those Tea Party protesters against the bill? Their public enemy number one, the public option, a government-run alternative to private insurers, is long gone. In fact, today's bill is a far cry from what many liberals once hoped for.
This is a middle-of-the-road bill.
Why? Some critics say, just follow the money.
This is the most heavily lobbied bill that we have ever seen. 4,525 lobbyists have been working on this. That's 8 for every member of Congress.
Bill Busenberg runs the Center for Public Integrity, which advocates for transparency in politics. They see the color of corporate money all over the bill.
It was across the board. I mean, you would expect insurance companies. You wouldn't expect Dunkin' Donuts, for example, to be in their lobby. They were working against a sugar tax, and they succeeded. There's not a sugar tax. The Cigar Association was lobbying. Why? They didn't want tobacco taxes to pay for this.
Now, is this bill perfect? Of course not.
But President Obama promised he wouldn't let the perfect be the enemy of the good.
Is this the most important piece of domestic legislation in terms of giving a break to hard-working middle-class families out there since Medicare? Absolutely.
Earlier this year, the president said we are close to the summit of the mountain. Whether or not he reaches that goal will be decided in today's vote.
If they get it through, Obama's done something that Roosevelt couldn't do, that Kennedy couldn't do, Clinton, Nixon. Obama becomes, in history, a quite major figure. Whatever else happens in the rest of his administration, or he becomes a minor figure, all in one day.